Okay, welcome everybody to the TAT 710E. We'll be working on this from now through the second week in August. We'll have a 2-day intensive protocol examination while we're in Santa Barbara. But we will start off with some information about the TAT and information about object relations to sort of help everybody get on board. Now, I was wondering, how many people are taking it because they're interested in the TAT? Now, how many people are taking it because it's attached to behavioral assessment and you sort of have to take it instead of the 5 credit Rorschach course?
Um, I'll talk. This is Eric Powell. I guess I am taking it because I am interested in the projective test. I mean, part of it is, I guess, a requirement, but I know my practicum I just started is part of our full assessment. We have to do the TAT, so it's kind of a nice bridge between actually doing out in practicum setting and actually doing the course.
Good, good. Anybody else?
This is Harry. I guess for me, it's a little bit of both. You know, like you said, it is part of the required for CBT, but also I am really interested in it, so I guess it's both for me.
Okay, good. Thanks, Harry.
Hi, this is Felisa.
Let's see, you're not coming through.
Hi, this is Felisa. I'm interested. I have to take it for requirements, but the practicum that I'm interviewing for, their theoretical orientation is object relations, so it would be good in working with them to already know how to do it.
I think the class will be very helpful for that. Okay, so people are here for various reasons. That includes being interested in the TAT, but also it's sort of like a forced requirement. But that's okay. I think that it's interesting enough on its own that you will find it that it can enrich your clinical life. But we'll see by the end of the semester. Joey is here. Joey is our teaching assistant who will run a lab every Thursday at 8 o'clock Eastern Time. So I guess it's 5 o'clock Pacific Time. And even though it's not required, I would advise people to take it because we don't have a lot of time in an hour to go through everything we want to go through. So do take the lab, and I think that you'll enjoy it. Okay, Joe's going to start out by talking some about the TAT. Ron.
Okay. Could you make me the organizer so that I can show my screen?
Yes.
So, hi everybody, I'm Joey. Like Dr. Ruffin said, I'm just going to talk a little bit about the historical background and development of the TAT. And if you have any questions, this is also going to include a little discussion of the original theoretical grounding as well as where we're at now with the TAT, at least in terms of the social cognition and object relation scale, which is the system that we'll be using. So there's kind of a central premise of the TAT and of projective testing in general, that individuals will kind of reveal things that either they're intending not to reveal for reasons of impression management, or possibly, you know, things they're not revealing because they don't know these things about themselves. So projective testing, and in particular the TAT, is very useful for accessing that psychological material. So this idea, the projective hypothesis, refers to the idea that stimuli are perceived and organized according to the individual's specific needs, motives, affective states, perceptual sets, and cognitive structures. Most of these perceptual, cognitive, and affective processes operate automatically with little conscious awareness or control. So in looking at this idea of the projective hypothesis as kind of the premise of interpreting the TAT, there's a good quote from Conklin and Weston, one of our readings, that in creating stories from ambiguous pictures that constrain but do not determine their responses, people will fill in the gaps between perception and narrative with many enduring expectations, fears, and desires that are activated in interpersonal situations in their daily lives. The stories that people tell in response to these cards say a great deal about their fears, their desires, their interpersonal styles, at least in a kind of implicit sense. And I'll talk a little bit more about this later in the discussion as we move into talking about object relations and social cognition as the theoretical basis for our understanding of these stories that we collect. So the TAT, and in your readings, you're going to be exposed to a lot of this information, but just to kind of overview. It was first introduced by Murray, Henry Murray, in 1943, and was very much informed by Murray's appreciation of psychoanalytic theory, but it was intended for use with non-psychoanalytic clinicians. And it really, although it contained some appreciation of psychoanalytic thought, it was really based more on Murray's own kind of personal theoretical or personal theory on personality, rather than reflecting what was the dominant psychoanalytic thinking of the day. And later on, Leopold Belloc came to work with, became part of Henry Murray's inner circle and began his work on the TAT. And Belloc was more properly psychoanalytically trained, and he eventually replaced Murray's system with a system for interpreting the TAT that was more theoretically grounded and practically and a little bit more practical for use in terms of people's psychoanalytic thinking of that time. So the constructs initially proposed in Belloc's system included dimensions of the main hero, which kind of was a leftover from Murray's approach. But in adding to Murray's approach, which Murray's original approach was more looking at the main hero and the environmental presses and internal needs of the hero. Belloc came along and kind of inject a little bit more classic psychoanalytic thinking, especially in terms of saying, well, let's look at the conflicts that arise in the internal conflicts that are indicated by people's stories, the nature of their anxieties, their defenses against these anxieties, as well as looking at things like the superego, our moral judgment, and general ego functions as well. And if I know a lot of y'all are from the CBT perspective, and if you are, you really needn't be concerned about whether this is going to make sense to you or be useful for you, because as we'll see, our approach to understanding the TAT is in part based on a social cognitive perspective, and really is very, while not atheoretical, is very kind of generalizable, I think. So the Belloc system really kind of was very much in tune with the classic psychoanalytic thinking of the day, and then around the 1980s, by the 1980s, psychoanalytic thought had come to have a much deeper appreciation of attachment especially with the work of people like John Bowlby and Mary Ainsworth in the 1950s and 60s, and all the kind of subsequent theory and research having to do with attachment and its kind of psychoanalytic correlate, which is object relations theory. You know, although object relations theory is not the same thing as attachment theory, there's kind of a lot of conceptual overlap, and this is really reflected in the modern approach to understanding the test subjects' responses, because in addition to looking at things like the anxieties and defenses and superego and moral judgments, there's also, as you'll see, an increased emphasis on the nature of our interpersonal, the nature of our interpersonal relations as they're kind of set up internally. So the most commonly used system today is known as the social cognition and object relation scale, created by Weston, and this is the system we'll be working with. So this object relations theory-based system incorporates elements of social cognitive approaches, as I said, and in addition to that, you'll also see that there's other kind of theoretical elements here, attachment, as well as in terms of the part of the scales which covers moral judgment, you'll see some influence of Kohlberg's stages of moral reasoning as well. This can be formulated in psychodynamic terms, but it also makes sense in terms of cognitive schemas. And so, anyway, this system was originally formatted in a kind of global rating system. This was later revised and then later again kind of elaborated into a Q-sort system, which is the system that we'll be working with. This assessment technique is informed by object relational. So social cognitive theory proposes that real-time information processing is informed by previously organized mental sets or schemas that structure knowledge about the self, others, and our world. And again, this is, these are things that are operating without our conscious awareness or control, which makes them kind of makes it ideal material for projective assessment. And object relations theory refers to a collection of psychodynamic theories which focus on the internalization of early formative relationships. Not just simply internalizations of those real-life early important attachment relationships, but also kind of the whole psychological internal world reflecting our fantasies, our infantile and childhood fantasies of these child caretaker interactions, and it wouldn't be correct to simply say, I guess, that object relations is all about the person simply internalizing the real life goings on between parent and child. It's also about all the things that we kind of emotionally and psychologically elaborate on in our affectively charged moments with our caregivers, and all that stuff becomes internalized and goes on to guide our real life interpersonal relations with people. So, at least to me, in my own thinking, there's a good amount of conceptual similarity between thinking of things in terms of cognitive schemas and thinking of things in object relations terms. Although when we think of things object relationally, we're talking much more of a dynamic unconscious rather than a schematic unconscious. And so there is a distinction, but there is also some real similarity and some congruity between these two approaches. So the object relation, the kind of theoretical approach that's explored in the social cognition and object relation scale is really more in line with a object relations later non-classical, non-Freudian, more contemporary psychoanalytic approach. So the SCORES Q, it allows clinicians to access several domains of interpersonal and intrapersonal functioning. And an advantage of this approach, like I said, is it allows the clinician to access material that is simply inaccessible through self-report measures and interviews. and you know, things are inaccessible, like I said, for a couple of reasons. Sometimes people don't want to reveal certain things for a variety of reasons, and sometimes there's a lot that we just simply don't know about ourselves or can't answer about ourselves in a true or false or, you know, Likert scale type questionnaire. There's 5 dimensions across which the scores G assesses, the scores Q assesses, and in the original scores, the original score system, it was only 5. This was later expanded, or actually no, I think it was only 4, and then it was later expanded into 6. But the current scores Q dimensions are cognitive structure of representations, affect tone of relationship schemas, emotional investment in relationships, emotional investment in values and moral standards, understanding of social causality, and dominant interpersonal concerns. So the first 5 of these, 1 through 5, are really just scales that you'll be, when you look at the person's responses, you'll be kind of rating the person according to how complex their structure of representations are, or the quality of their affect tone of their relationships that are depicted in the stories. The 6th domain, the dominant interpersonal concerns, isn't so much a scale as it is a list of 53 thematic items that reflect our kind of interpersonal, you know, interactions with each other and internally. The two scales, emotional investment in relationships and emotional investment in values and moral standards, excuse me, these 2 scales in the original score system were actually 1. And one of the revisions that were made when this went to a Q-sort system was this was split into 2 separate scales, and as well as the dominant interpersonal concerns domain being added. So, complexity of representations of people, the cognitive structures of representations, same thing. This scale measures the extent to which the subject clearly differentiates the perspectives of self and others, sees the self and others as having stable, enduring, multidimensional dispositions, and sees the self and others as psychological beings with complex motives and experiences. So, really, if you think about, I don't know how many of you have much experience with clients or patients with severe personality disorders, but if you do, it can be kind of useful in orienting your thinking a little bit, because you'll kind of recognize that folks with personality pathology, and the literature reflects this as well, as we'll see, they tend to rate pretty low on these different dimensions. And so, you know, if you think about someone who has a really difficult time differentiating their own perspective from the perspective of others, and, you know, they kind of assume everyone should, or everyone does think the way that they do, or a person who doesn't have stable, enduring, multi-dimensional and well-integrated conceptions of other people, but rather have really kind of vacillating, all good or all bad, unstable kind of, you know, representations of other people. The affect tone of relationship schemas. This scale measures the affective quality of representations of people in relationships, and it attempts to assess the extent to which the person expects malevolence, pain, or the extent to which social relations are viewed as empty, benign, positive, or enriching and positive and good. So, as you'll see in the different protocols that we'll look at, the stories that are told that are in response to what are relatively neutral stimuli, although some of them are a little kind of almost macabre sometimes, I feel like, but they're relatively neutral, and you'll see in different people's responses that people come up with very different stories involving very different types of people, and some of the relationships that are depicted are very rich and loving and supportive. Some of the relationships that are depicted are empty and barren of affect. Some of the relationships are downright hostile and malevolent. And so this particular domain, the affect tone of relationships, is it looks at rating where a person falls in terms of the quality of the affect in the relationships that are depicted. So emotional investment in relationships. This scale addresses one's capacity for engaging in mutually gratifying, deep, committed, and trusting relationships. Although maybe I should rephrase that to say it doesn't really, I don't know if it'd be accurate to say it really assesses the subject's capacity in real life. But what it does is, in terms of the story that the person tells and what you can pull from that story, it gives you some indication of how they view relationships, how they experience relationships, what they expect from relationships, etc. And that oftentimes does relate to the person's real life experience. I just don't want to get into saying that like what the person says in these stories reflects what their real life experience always is, because that would definitely be an overstatement. Less healthy personalities tend to have patterns of interchangeable, highly tumultuous, or shallow relationships, and this is often reflected in the stories they tell. Whereas what you'll see with healthier personalities, you'll see more stable, supportive, loving, and invested relationships. In terms of investment in values and moral standards, what's being assessed here is the subject's capacity for internalization and utilization of moral standards. And it addresses what in classic psychoanalytic thinking is referred to as superego functioning. But like I said, it also incorporates elements of Kohlberg's stages of moral reasoning. And it also has elements of contemporary social cognitive theory as well. So in this domain, we're looking at things like, okay, does the morality that's depicted in this story, does it contain completely antisocial acts without any kind of moral commentary? Are there very antisocial acts that are then kind of repented for and avenged in some way? Are the characters depicted, do they have strong moral fiber and don't break the rules because that's the right thing to do? Or do they not break the rules because they want to avoid getting in trouble? And so, or does the morality depicted in the story kind of reflect the person's own individual kind of understanding of right and wrong versus kind of the more societal idea of what's right and wrong? So, understanding of social causality measures the extent to which attributions of the causes of people's actions, thoughts, and feelings are logical, accurate, complex, and psychologically minded. So at one end, causality is illogical or illogical, with confused, inappropriate, or highly unlikely attributions. So in these cases, the stories don't make a whole lot of cause and effect type of sense in terms of what happens to the people and why they do the things that they do, and the whole plot can seem kind of disjointed. But on the other end, the subjects manifest an understanding of the way complex psychological processes, including unconscious processes, are involved in the generation of thoughts, feelings, and actions. And so at one end is a very kind of chaotic or just uncohesive way of looking at what happens, in the world between people. And on the other end, the healthy end, there's a more psychologically minded understanding of interpersonal interactions and people's experience in the world. So, like I said, the dominant interpersonal concerns domain, this isn't a scale as much as it is a list of thematic items that commonly occur in protocols. And these typically include interpersonal themes such as love, achievement, competition, rejection, abandonment, sexual victimization, as well as many, many others. And these items would derive from clinical observation, anthropological accounts, as well as different domains of psychological theory. And that brings me to something I want to mention as well, which is as we go through learning how to use the system to interpret these protocols, and each of these are readings that are on the syllabus, I believe. As you go through and kind of increase your understanding of how to interpret these protocols using the SCORS Q system, it's important to keep in mind that this is a research-based system. I didn't really have much of a chance to talk about this, but you'll come across this in your readings, and we'll talk about it, later on, I'm sure. But this is a research-based system, and that includes research on, its reliability as well as its validity, its predictive validity in clinical populations particularly. And that when you're interpreting these protocols, it's not simply this kind of impressionistic thing that is really more about what you see. You do have to use your own internal reaction to the both individual responses as well as the entire protocol. There's a strong element of subjective clinical judgment on the part of the clinician, but at the same time, this is a research-based and empirically, at least in part, empirically informed way of understanding and interpreting these protocols. So that's basically all I have to say right now. Does anybody have any questions?
But we'll wait and see if questions come up later. But that was a wonderful presentation, Joey. Thank you. I wanted to talk about a couple of things that Joey had talked about, and one has to do with the dynamic unconscious, which is to be compared to the social cognitive, either subconscious or out of consciousness. The dynamic unconscious is a motivated unconscious. That is, that we are motivated to keep out of awareness things that will lead to the experience of internal conflict. Right? And that process occurs in the dynamic unconscious. So there's not only things that we are aware of and things that we're not aware of and things that we don't know, but there also are things that we don't want to know, and therefore successfully put them on the other side of our consciousness. Okay. The other thing is that in terms of the affect tone, which is the second measure, what was of interest when it was originally done is that people, and this is both young people and adults, who are suffering from borderline personality disorder, or borderline personality organization, I should say, not disorder, tended to have much lower tend to be much lower on the scale of affective what's the word? Well, I'll continue and it'll come back to me. So that was one of the beginnings that helped people move away from the original concept of borderline personality disorder, which has to do with that there's a trauma that happened in the first 3 or 4 years of your life. Anybody can be made to be borderline if it's a bad enough situation, and there is no developmental aspect to it. You're certainly more prone to it if you are a child and are suffering abuse or neglect. Okay, and the other thing that I wanted to talk about are the 6 dimensions that Joey mentioned, are the dimensions that we're going to use. So I wanted to talk some about the syllabus and what you can expect from the course. But now that we had some time to think, does anybody have any questions around Joey's presentation?
And I would also add that Dr. Ruffins mentioned the borderline personality organization, which is, if you're not really familiar, I'm going to be talking a little bit next week. I'll talk briefly about object relations theory, and I'll talk a little bit about the idea of personality organization and what that really means. Because again, I know maybe some of y'all not coming from a psychodynamic perspective might not be totally familiar. So I will talk more about that. But and if any questions come to you over the next couple of days, you know, that's what we do on our Thursday meetings. Is I really kind of just make myself available to whatever questions y'all have or whatever. So just wanted to mention that.
Terry, I have a quick question. So I know the the scores, I guess, is like one method of scoring. So are those domains or dimensions that you went over, are those stuff that you're going to see sort of regardless of what scoring method you use, or is that specific to the scores method?
It's specific to the scores method, though there are other methods in terms of assessing object relations that are similar. But the difference is that this is about trying to discover the person's internal representations of how the world is structured, both in terms of themselves as the subject and the other person as the object. So this is best not to use rules said like mirrors, which had to do with achievement. What this will give you is the capacity in your test report to write 2 or 3 paragraphs about the person's internal representation of people, or their schemas of self and others.
Okay, thank you.
Any other questions before we go on? Okay, you should see the syllabus that I put up. The first part is just regular information. Then the course is described. It's 12 weeks and we have a 2-day face-to-face lab. And then it talks something about the development of the scores related to social cognitive and psychoanalytic theory. And then there's the learning objectives of the course. And those are important because those are the things that we want you to be able to get out of the course, which is to understand the development and the theory behind TAT techniques. Now, we're not going to spend a lot of time on that because we're going to spend most of our time on scoring and learning about object relations and scoring protocols. But the reading provides a lot of that information about the development and the theory behind the TAT. Okay, you have to be able to demonstrate proper administration of the TAT. I'll talk some about that, and we will practice that in when we're in Chicago, not in Santa Barbara. Unfortunately, we're in Chicago. Know the basics of one of the 5 standardized scoring systems, and that will be the scores. Know at a beginning level how to interpret and apply thematic apperception measures for assessments. Be familiar with theory and research applications of the TAT, including cross-cultural studies. There's a lot of cross-cultural disagreement with the TAT that you'll read about and maybe write a paper about. Number 6, be able to write up TAT results in a format appropriate for inclusion in an evaluation report. And we'll be doing that by the very end. The required texts are Bellick, which is the TAT and CAT and SAT in clinical use. DANA, which is the Handbook of Cross-Cultural and Multicultural Personality Assessment, has a really important chapter, a number of chapters related to cross-cultural issues and personality assessment. And then Hedvig Teglassi's Essential of TAT and Other Storytelling Assessments. So those things are in the readings that you'll have week to week. Okay, so then there's the required readings, which is required journal readings. And you can get the Bellac book for about $30 if you get it used from Amazon. And you can get the Dana cross-cultural book for about 114 used. Okay. Then there's recommended readings and assignments. Okay. There's a number of assignments and requirements. So you're required to have a set of TAT cards and bring them to the summer session. You must have a set of TAT cards. I've sent everybody's name to PAR testing, so you'll have the authorization to purchase them. You want to familiarize yourself with the TAT cards, especially the cards that we're going to be using over and over again, which is 1, 2, 3 BM, that means for boys or men, 4, 5, 6 BM, which is for boys or men, 7 GF, which is girls and females, 8 BM, boys and men, 12 and 18 GF, which is girls and females. There's a dreadful but still helpful YouTube video that I sent you that'll give you some hint as how to structure the assessment session, and we'll go over this in the summer session. And you are to make up Q-sort cards in advance from the templates provided by the faculty. The course will consist of a number of assignments. There's studying the literature and scoring the TAT protocols in a 14-week seminar, and that's 30% of the grade. And then attending the 1-hour go-to-meeting sessions is about 10% of the grade. And writing a paper on the development and theory behind the TAT with a critique of its strengths and weaknesses, including its cultural strengths and weaknesses, are also 30% of the grade. And then write a paper critiquing one of the readings that are required or recommended. And you should utilize what you've learned from the other readings to critique the paper. And that's 30% of the grade. So that's how we get to 100%. Okay. And you have to attend the 2-day lab at summer session. Next goes into the course schedule. So I expected that between the 6th and yesterday, Sunday, that you had a chance to read the Social Cognition Object Relations Scale from Weston, the Dimension and Items from Weston and Conklin. And this week you'll be reading from Belloc and Abrams and Teglassi. You'll be reading chapters related to the introduction of the TAT. And then you'll be reading Conklin and Weston again. The Conklin and Weston paper from 2001 and the Social Cognition Object Relations Scale measure are the two most important things that you will be using in terms of our scoring. So next week we will talk about object relations and some more about the TAT, and then we're going to go directly into a protocol, which means that we will work on a protocol Monday nights. We won't finish it. I'll have you. And the next Monday we will go over the scoring of the protocol. That essentially is how we're going to operate. And June 1st, you hand in paper number 1, which is the paper on the development of the TAT. The rest of the seminar, essentially, there is no volunteer protocol, so you can scratch that out. For the rest of the semester, as you can see, we will go through a number of protocols and deal with scoring. And then I will give you one protocol for you to score as a test, and you have a week to be able to do it. Okay. Then there's grading criteria, the outcome and goals, of course. Remember the academic integrity statement. I affirm that this is my original work, et cetera, like that. Okay, that's pretty much the semester and the readings. Does anybody have any questions?
Dr. Effens, this is Rewa. I have I hope this is a little bit of an ignorant question, but I'm reading that we have to create our own Q Swords cards, and I really don't know what that is.
Okay, well we have
right?
We have some time to do that. Essentially, what I have. Okay, there's feedback here somewhere. Okay. I've given you the template for the sword cards. They're approximately 2.5 inches by 3.5 inches. And I gave you the labels that you should get from the store in order to go along with that. And really what you'll do is you'll put the labels in your, is everybody getting feedback or just me?
Yeah, I'm getting feedback. Everybody, if everybody could mute yourselves, if you don't need to be talking right now, please mute yourself. That might help eliminate the feedback.
Okay. So then you will have the templates in one hand and the labels in the other hand. You put the labels where you normally put your paper in the Xerox machine or whatever, and you put the template upside down on the computer screen, and then you just make a copy. And what you get is 10 or 12 cards that you then just take. You tear them out of the 8.5 by 11 box that they're in. Okay, does that answer your question, Rita?
Yes, I bought the cards, so now I have to just make them, I guess, with the label.
Yes.
Okay. Yes, it does. Thank you.
Okay, what other questions?
Dr. Ruffin, we'll actually get the protocol on next Monday's call, or will we have?
No, the protocols will start in the third week. Okay, any other questions? Okay, is everybody here? Let me see. Eric, 2, 3, 4, 5, 6, 7, 8. 8 people. Okay, there's 2 people missing. Okay. Okay, no questions. Either about the TAT or object relations or about this semester?
I have a question. This is Rhonda.
Hi, Rhonda.
It's going to be hard for me to get here before 5:10. Is the first 10 minutes recorded? I notice it says the session is being recorded.
Yeah, we'll record the entire session.
Okay, good. And then it'll just get posted somewhere on Moodle, I'm
Yes.
hoping. Okay, great. Thank you.
Okay, we have 10 minutes left. Enough time to have a nice conversation about some of the things that we were talking about this evening.
Dr. Evans, I was very curious about what you said about borderlines. Could you elaborate a little bit on what you were talking about, the new conceptualization that is not
Yes,
necessarily a developmental issue?
right. Somebody has to mute themselves.
Mute me.
Okay. Yeah, that's it. The theory behind borderline personality organization used to be that it developed when a child was very young. That the iteology is when you're very young, and that you were stuck at a particular point in development. It's called separation individuation. This is the work of Margaret Mahler. So that what happened is that the person gets caught in that state and never gets a chance to experience more ambivalent and sophisticated defenses as they get older. What this SCORES research showed was that people with borderline personality organization are most unlike other people, and this includes average teenage girls and depressed people in the hospital, and that the big difference was the difference in the affect tone of the stories that they told. The affect tone of the stories that they told was much more malevolent, and the other parts of the score system, the social cognition, for example, unless they were in the midst of an affective dysregulation, they scored as well as anybody else. Does that explain it, or should I explain some more?
Yeah, that's very interesting. So it's more related to emotional regulation than it is the developmental issue.
Right. And this is work that Marsha Linehan does as well, from a radical sort of cognitive behavioral point of view, that the person has difficulty in regulating themselves, and that when they are effectively stimulated, they become dysregulated. And that's why they engage in splitting. That's why they're fine 1 minute and they're in a tizzy the next minute. It's because that affective stimulation, and it's just not necessarily negative affective stimulation, it could also be positive affective stimulation, but they don't have the capacity to hold that. What they do is they just then respond to it. And if it's negative, they respond to it as if it were an attack.
Thank you. Very interesting.
Okay, what else? Okay, I don't know how to interpret nobody having any questions. Maybe Joey's presentation was that clear that it covered all of the possible questions that we might have. So it's 8:55. So what we'll do is we'll break 5 minutes early, because we might go over 5 minutes some other time. But we will break 5 minutes early. Please do your reading for next week, and we will see you then. Okay, everybody, have a good night.
Good night.
Bye.